I'm here today to talk about caregiver burnout. Caregiver burnout is something that you can have if you are the main caregiver for a loved one. There are some things that do put you at a higher risk. If you're caring for someone with Alzheimer's disease, dementia, Parkinson, diseases that are very draining physically, emotionally, mentally, that can definitely put you at a much higher risk. There are some signs that you can watch out for caregiver burnout. Some of them are depression-like symptoms, fatigue, decreased energy, insomnia. Also, if you're suffering, if you feel guilt, or you have changes in your mood, one moment you're happy, then you're sad, then you're angry, or you feel like you're getting sick all the time, you're catching every bug that's out there, or your temperament's changing. People are telling you that you're in a short temper, you're in a short fuse, you don't really have enough time to exercise, or your physical activity has decreased. You can't remember the last time that you spent time with a friend, had a conversation with them, or went out for drinks. That is something that can definitely put you at a higher risk and be a sign of caregiver burnout. Now, if you are the main caregiver and you feel like you lack support, you feel like all the responsibility rests on your shoulders for that person, you could be suffering from caregiver burnout. There are some resources available to you. The National Family of Caregiver Support Program, NFCSP, which was established in the year 2000, provides grants to states and territories based on their share of the population aged 70 and over to fund a range of supports that assist family and informal caregivers to the care of their loved ones at home for as long as possible. Some of the services available to the NFCSP are information to caregivers about available services and information on how to access these, individual counseling, organization of support groups, caregiver training, respite care, and supplemental services on a limited basis are available. Also, there's a website called eldercare.gov. If you go there, there is a space that will allow you to put your address and your zip code. And on the other side, there's a drop-down menu for the resources that you're looking for. If you just leave that empty, it'll give you all the resources for you locally. Or you can click on the specifics like caregiver, nursing home, and it'll list those for you. If we were to do that for the area that we're in, which is Central Ohio, it would direct us to the Central Ohio Area Agency on Aging, the COAAA, which is a website that can give you information on caregiver support groups, caregiver workshops. Also, if you were to contact them, you can get the staff can provide you with free caregiver advice, education, and support for those helping loved ones. The COAA can advise you on hiring, financial help, and senior housing. Also, the COAA, they do have a 1-800 number. It's 1-800-589-7277. And the website is coaa.org. On their website, you can find information about the dates and times of the caregiver workshops, the caregiver support groups, and I will highly recommend those. If you go and you're suffering from caregiver burnout, it will definitely help to know that you're not alone. There's other people that are going through the same thing. They can give you some pointers, some things to do to improve your lifestyle and make things a little bit easier for you. Now, there is some other resources like respite care. What respite is short-term assistance by an outside provider, usually in the home, which allows the primary caregiver time away from the responsibilities, time away from the caring of that person, so that they can relax. Now, you can access that information through the NADSA.org for more information on those, on respite, or you can also contact your local area agency on aging, and they can direct you on where to get more information on those resources. Thank you for watching.